Welcome to Red Light, Green Light, the podcast where you'll hear from industry leaders in science, technology, and innovation about the power of strategic storytelling. With decades of experience, our guests will share their own insights and real-world stories to help you avoid red light barriers and ignite green light solutions. From the Zoom room to the boardroom. In each episode, we'll corkscrew downward into the guests' personal experiences of challenge and success, highlighting strategies that turn complex ideas into clear, compelling storylines for stakeholders. Here is where expert minds share stories that shape the future. What's more, you'll walk away with tips to try immediately to drive the vision of innovation with your team. Hi, everybody. Cindy Skalicky here, bringing you another incredible episode of Red Light, Green Light, the podcast where we find for you executives in science, technology, and innovation to share their storylines after decades in the industry and their learnings, their observations, and their stories. So today, I am very excited to bring to you all Moe Abouzari. Moe, thank you so much for joining us today.
Pleasure to be here. Thank you for the invitation.
Yes, you're welcome. Let's dive right in, and I would love for you to share a little bit about your expertise and your experience so far in the industry. You have a really beautiful and eclectic background in a number of different areas, especially kind of that deep science and pharma. So let's hear some of your stepping stones, Mo.
Sounds good. Yes. Well, hello, everyone. Thank you for having me. As you mentioned, it's been an interesting road to get where I am. I was, after graduating from college, undergrad, I was a scientist. I worked in the laboratory as an analytical chemist with the vision of always wanting to become a clinician. And the opportunity was given. I went to medical school as a podiatrist, finished podiatry school, did my training, and I ended up doing a fellowship, being very keen on wound care for diabetes.
Okay. Oh, interesting.
Which revolves around not only looking at the patient as a whole, but also looking at their socioeconomic aspect of life, as well as why somebody who's in their 60s, they get a small wound and it never heals. So the whole idea of infection prevention and infection control came to me as I was working through my fellowship.
Mo, can you remind me, I know there's a connection between diabetes and the foot being problematic. Can you help us and refresh our memories on that?
Absolutely. Thank you for that question. So actually, our feet are the first place that we see a sequela of a lot of diseases because it's the furthest extremity from us. So if you, for example, have a vascular disease, your feet are where you see that vascular disease pronounced initially with lack of hair, skin. Diabetes is no different. Diabetes being an endocrinological disease, it impacts more than just our blood sugar level. It impacts our vascular system. When you have too much sugar, it burns your nerves. That's what a lot of diabetic patients have, what is called peripheral neuropathy, where they don't feel in their feet. And it's kind of that reason where when they get a wound or a burn, they don't feel it.
Oh, wow.
And that wound continues to be infected, continues to be troublesome for them. And there are diabetic patients who end up losing limbs because rather than having a bone infection spread through your body, you end up having to have amputation. But as podiatrists, we are taught to be limb salvage experts. Our job is to make sure that we don't cut more than what we need, which is very different than how some of the other practices deal with infection.
Okay.
So yes, diabetes, it's impacts a lot in your nail structure, your skin structure, your vascular disease, um, and so many other things.
Okay. So
So it
early
impacts our
on,
feet
like
first.
podiatry plus wound prevention care in diabetes was kind of your first kind of stage then in your career?
It was this stage in my career, and during that period, my mentor at that institute, who was the head of the program, introduced me to medical affairs and introduced me to what life is beyond clinical practice.
Okay.
Because when we go to professional schools, we never hear about other aspects of what can happen as a professional. You only learn that as talking to sales rep in the industry or
Hmm.
when you meet another medical science liaison and kind of grasp that knowledge. But he came from the field himself.
Okay.
And he basically was the reason I decided that I can impact more patient care if I go into the
Yes.
industry.
Great. Okay.
And he introduced me to the field, and I started doing some consulting work
Okay.
as a medical expert with some of these wound care companies that I got to learn. There were several other individuals who introduced me to counterparts in the industry, and it kind of got flourished
Mm-hmm.
into a full-time job.
Okay.
And
The
I
consulting
was,
work is what
yes,
you're
the
talking about.
consulting work
Okay.
ended up being a full-time job. And I was fortunate enough that as a previous customer in the analytical world of Thermo
Mm-hmm.
Fisher, there was an opportunity that I came on board as a full-time medical science liaison with Thermo, focusing on two things I really love. One is diagnostics
Okay.
and instrumentation, and the other one was infectious disease. So
Okay.
they had a biomarker that focused on sepsis prevention or
Okay.
sepsis determination.
Yes.
And
That's a
as we
problem.
all
That's a
know,
death sentence
as
for
we all
most
know, sepsis
people.
starts with infection,
Yes.
and the rest was history. And I pretty much stayed in that field for a good 8 to 9 years.
Hmm.
Recently, the device industry has slowed down a little bit,
Mm-hmm.
and I
Do you know why
was
that is? Like what makes you say that?
so it's actually funny. My thought process from why the device industry has slowed down had to do a lot with COVID.
Okay, sure. That makes sense.
Not just from the perspective of what COVID did to the industry
Mm-hmm.
as a whole, but COVID required a lot of companies to think outside of the box, coming
Mm-hmm.
up with a lot of new assays, coming up with
Mm-hmm.
a lot of new diagnostic tests to figure out, is it COVID or is it something else?
Mm-hmm.
And
Mm-hmm.
I feel like there was a business thought to it
Mm-hmm.
that it ended up causing havoc from the perspective of what tests are actually good and what tests are not good.
Okay.
And I think that kind of shifted the industry a little bit from the perspective of things were halt now from the diagnostic perspective.
Do you think it's more cautious now as a result of that then?
I would
Okay.
say that's definitely one of the venues that
Okay.
is impacting why the diagnostic industry has slowed down.
Okay.
In general, though, comparing diagnostic to pharma where I am now, I would say um, a lot of clinical mindset is that I know what I'm doing. I don't need a diagnostic to tell me what I'm doing.
Oh, interesting.
So
Okay.
I would say,
Huh.
from a perspective of a short-term clinician, in my mindset, there is some
Mm-hmm.
ego involved as well.
Yeah, that's really interesting. Well, Mo, I want to tap the medical science liaison piece in a minute, but I want to chat about one thing you said earlier that came to my mind. We've done some work with big pharma and specifically some in veterinary pharma. And I remember when I was with them for like an on-site day in Arizona, we did some training and we were out to dinner and I was talking with the veterinarians and I was still learning the business that they were in. And I said to one of the doctors, why do you want to work for this company versus being with the animals and on, and caring for them. What made you make that leap? And I got a really clear answer, which I think is where you're at as well, Mo. Like, well, I wanted to have more impact at scale. And I realized that I can see about, whatever it is, 50 pets a week in my clinic if I stay in the clinic, or if I work here at this pharma company, I can help thousands, tens of thousands, and have more impact at scale now that I have that expertise kind of on the ground, if you will. Is that right in line with
I
where?
would say absolutely. And
Yeah.
it's also the nature of our healthcare system here
Yep.
as clinicians. Um, we we want the best for our patients.
Right.
And
Right.
when you have to fight to get that, there
Mhm.
is a time and place that you really get tired of fighting.
Yeah.
And the
Interesting.
decision becomes that, what do I want to do with my life? Of
Right.
course, I would still love to see patient. I would still love to be involved. I feel like in my current roles that I have done, um, I am involved. I am
Mm-hmm.
involved in bettering healthcare for
Mm-hmm.
everyone
Like in a
with
broader
diagnostic, with
way. Right.
medications.
Right. So, MSLs or medical science liaisons, that's a new, segment of the field to me that I've just been learning about, but it's so interesting to me. And I'm not going to do the definition of it justice, but what I am so curious about that I would love to talk about next is the balancing act that MSLs have to play, at least as I see it, between being kind of this, between informative communication and persuasive communication. I mean, your role in a lot of ways, as I understand it, is around educating and informing people about treatments, diagnostics, drugs, whatever it is, versus, selling or persuading in a really direct sense. Can you expand on that a little bit? Tell me if I'm
Absolutely.
right or
So,
wrong.
so no, you said it pretty well. There is, well, MSL, the role of MSL has been around, but the name
Yeah,
has changed.
right.
I mean, MSLs have been around for probably since mid 90s. There are some great books on it. There are some great societies. The Medical Science Liaison Society is a great place if you want to learn about MSLs. Of course, nowadays there is a good presence of MSLs
Yeah,
that, to your point exactly, we're not selling
right.
in a traditional way, but
Mm-hmm.
at the same time, we are still selling knowledge, and
Yeah,
that knowledge results into the benefits of what a medication or diagnostic or device has for a patient. But yes, so the difference I would say in this evolution is that most MSLs are scientific backgrounds,
mm-hmm.
either PhDs. It used to actually be only PhDs, but then it kind of expanded into other roles as well. Right now, the market is really hot with PharmDs because
Yep,
PharmDs see both the patient and the scientific side of things. So
right.
they're very integrated.
Yep.
Not to say that other disciplines like NPs or PAs or DPMs or MDs or any of the other professional degrees, doctorate or masters cannot do the job. If you understand science, if you have a good
Sure.
knowledge base of patient care, you
Mm-hmm.
definitely can become MSL.
Mm-hmm.
It's
Mm-hmm.
not a big deal. And then, as I mentioned, there are institutes that you can get a board certification through them that shows that you are a professional
Yep.
in your
Right.
training. I belong to the MSL Society. I was fortunate enough to actually be one of the beta testers of the MSL board certification program they had.
Nice.
Um,
Okay. That's really
and
cool.
it was a privilege to be part of that program.
Oh, that's great. Innovation right inside of the MSL, sort of like sidebar. So that's fantastic.
Absolutely.
I love that. Mo, talk to us about audiences that you have spoken to. A lot of what we talk about on this podcast are some of the ways in which, as speakers or presenters, when we're faced with an audience, we're looking for ways to help that audience see our idea or our educational, point as a green light of go, like, I understand, I'm ready to move, I agree with you. So what are some of the places you've found yourself in where you're presenting about your, what are you doing during the days when you're working with
So
audience?
it's interesting because I, as a side note, I recently switched from medical devices into pharma world. So pharma
Mm-hmm.
world and medical device are a little bit different from the
Mm-hmm.
perspective of your audience.
Okay, how so?
I would say in pharma, since your medication has clear notion of disease therapy, you
Okay.
usually talk to specific providers. For
Okay.
example, right now, my company focuses on rare disease focusing on endocrinology. So there's a lot of endocrinologists I speak to. There are endocrine surgeons I speak to.
Mm-hmm.
Um, there is off topics from time to time that you talk to some community providers or benefit providers and things like that, but we don't really get involved with non clinicians that see patients.
Okay. Okay.
I would say on the device side of things, because device impacts multiple disciplinaries in a hospital. So device
Mm-hmm.
usually sits in a lab, but the person who's running the test is not the person who's treating the patient. So
Right. So you have,
also have to
mm-hmm.
focus on the
Yeah.
providers.
Yes. More
Now,
diverse audiences, more cross-functional
exactly,
leadership.
exactly. That's
Okay.
perfectly put. It's
Yeah.
really cross-functional because you also have to deal with payers.
Yes.
So have to deal with quality control measures in the hospital so that there's a much more diversified audience.
Yes. Well, let's use that as an example then to sit in for a minute. And I'd love to hear from you how you approach one of those kinds of conversations when you're speaking. And, what are you thinking about in your mind about, the variety of people, the message that you need to deliver, and how you're going to try to do that the best way that you can. What are some strategies that you have found work well to get those
Absolutely.
audiences going?
So, in my previous roles, when you do a presentation for such a diverse audience, you need to make sure that the message that you're sending to these folks, it's going to cover all aspects of the mission to
Yeah.
an extent. You don't want to be too focused, narrow-minded on just the science.
Right.
Um, One of the things that I do also have background in business. I have an MBA in healthcare
Oh,
management.
that's hugely helpful.
Early on, I learned that in order to understand healthcare, you need to understand what it we call nowadays as the business of health,
Mm-hmm. Hmm.
which is completely different than what caring for patients is.
Yes.
So from those two perspectives, you need to kind of merge things
Yes.
and be able to discuss what are not only the benefit to patient care, what are
Mm-hmm.
those benefits to the hospital, what are
Mm-hmm.
those benefits to payers, what are those benefits to the bottom line? Because fortunately or unfortunately, nowadays our hospital systems are businesses. They have CEOs,
Yeah,
CFOs,
absolutely. They are. Mm-hmm.
are no longer actually clinicians.
Mm-hmm.
They come from the business world, and
Right.
the thing they're looking at is the gains and the losses for the
Sure.
hospitals.
That's just the way of the world. Right.
Exactly.
Exactly.
And as somebody who understands those two notions, you get to merge the conversation. You
Yep.
to be clinically inclined to tell the doctor why there is a benefit to this test for your patient who are sitting in the emergency room, and then translate that and say, look, if they see more patients, they can make more financial security for your hospital.
Right. Like if you
Course, as
use,
an MSL, you don't really want to get into the financial stuff depending on where you are. I do
mm-hmm.
health economic presentations as well. I have background in health economic, and
Okay.
um, that's where you can actually talk business with some of these folks.
Yes. Well, can you give us a specific example of some, going back way through all of your years, like is there something that our audience might be able to think of as, either a diagnostic that you've talked about in the past or a tool that you've had to bring to an audience? Is there one specifically that we would all
So,
know?
one of the companies I worked at, they had a new diagnostic that was able to separate viral from bacterial infection. Now, why is that important in the notion of emergency medicine or infectious disease?
Mm-hmm.
Our shotgun approach of if somebody has fever, we think they have an infection, so we automatically give them antibiotics.
Mm-hmm.
It's one of the reasons that almost 70% of the antibiotics we have nowadays in the market don't work for certain
Yeah,
diseases.
we're like immune to them. Right.
Exactly. They develop resistance.
Right.
Bugs that we deal with are they are the original occupant of Earth. They
Mm-hmm.
evolve much faster and they
Mm-hmm.
propagate much faster than humans do.
Yeah.
So they can share cross ideas with each other about resistant developments.
Mm.
When you have such a thing, we only have, imagine yourself having a small bottle of something, a potion,
Mm-hmm.
you have an ocean. That a small bottle is not going to impact that ocean. But if you open that bottle, the ocean will impact that small bottle.
I
That's the
see.
notion of medications that we have nowadays. So
Okay. Okay,
that's
that's a great example and something tangible that we
yeah.
can think of. I'm imagining the argument you might bring forward, right, about the, tests that you could have emergency doctors using, for example, that can just delineate between viral and bacterial. And, thinking through the presentation, you might share data on how much time this will save, how much wasted medication this will, you would avoid doing, and just better healthcare all around in terms of making sure that this becomes the standard of care in terms of the clinics and the emergency rooms. Where do you see, Mo, a place for, or do you see, a place for storytelling in the type of work that you do?
So any presenter that is a good presenter is a good storyteller.
Mm-hmm.
And if you want to resonate, that's why a lot of time in these um, places that you present or these congresses you go, they have patient advocates who come and
Yeah.
talk about their story and how
Right.
something saved them and or how something caused harm to them.
Right. Okay.
Storytelling is the largest part and
Mm.
the most successful part of any presentation. Now,
Yeah.
you have to stay within lines of what is true and what is not, but at the same time, nobody says how to tell your story.
Mm-hmm.
Uh,
Hmm.
so
It's
there
not
is,
easy for everybody to do that
yeah,
well. And I
yeah.
know, you've kind of got an affinity for communication skills and you like it and you enjoy learning about it and you have, an outgoing personality. Many scientists just frankly aren't that interested in, the networking as much as the work because that's what their skill sets in. So how do you go about doing that, Mo, so that, storytelling is just sort of part of your presentation? How do you get better at that skill?
So for me, usually it's of course you have to when you present, especially on the pharma side of things, you have to stick with the script.
Mm-hmm.
Nobody ever says that you can't engage your audience. And for me, one of the best parts of my job is
That's
to ask
great.
the audience, hey, do you see a patient like this? Have you had
Yeah.
a patient like this? And
Yes.
especially on the
Yes.
side of, I never practice to the extent of some of my colleagues, or by no means I am an emergency room physician.
Mm-hmm.
Have I been in an emergency room both as a physician and a patient? Absolutely.
Mm.
And for me, as that, I relate that to my clinicians.
Love that.
You
I
know,
love that.
remember that patient. What one of the funniest line that you learn from colleagues is that the kryptonite of every emergency room physician is the next morning somebody come up to them and says, "Remember that patient from And that automatically gives them PTSD because
Yes. Oh,
you
geez.
don't know if the conversation going, they healed, they left, or they
Yes.
got admitted and now they're in the ICU.
Yes. Right. Oh,
So you
scary.
have to find that commonality.
Yeah.
As you divulge into the field of emergency room medicine, infectious
Mm-hmm.
disease medicine, endocrinology.
Yeah. Oh, that's just bad. I'm still sort of stuck on your comment, which made me laugh about how nobody says you can't engage your audience. And the reason that's funny to me is because so often, especially in the medical and scientific realms, there's a lot of rules about what you can say and what you can't, whether it's in a presentation, an email, a document. And it's just funny. Like there's nobody that
Yeah, there's
says,
definitely chokeholds on how
sure. Oh, well, there has to
you
be. I mean, that makes sense to me. Sure.
and nobody says don't, but to engage your audience, when you do enough speaking engagements,
Mm-hmm.
you learn to pick up things.
Yeah.
And even sitting in other speaking
Presentations.
programs,
Yeah.
you have to learn. I would say the most effective speaker is the one that does tell a story, is the
Yeah.
one that presents
Right.
slides. And why
Right.
is that? Is because you're there to share your knowledge, but
Mm-hmm.
also there realizing that you're gaining knowledge from
Yes.
your audience.
Yes.
One thing that we miss in a lot of these presentations, especially those coming from the academia,
Mm-hmm.
is they
Mm.
feel like they have to teach.
Yes.
And in a
Amen.
public presentation, you don't have to teach. We are
No.
not their students anymore. We are colleagues.
Right.
That's what you need to remember and learn.
Well, and you're hitting on a big piece that we frequently are sharing, which is like, uh, don't tell people what you know. Tell them what they need to hear. And
Exactly.
so where, that's a big simple, right? But a big flip of what we're really thinking about as we prepare a presentation. So we've talked a lot about kind of what works well and what we need to have for ingredients. Can you share a few things around those kind of red lights that when you're in the audience and you're like, man, this is not working, this person is not engaging me. What are some behaviors that you notice that lead audiences to red lights and keep
And I
them
would
there?
say the worst thing as a presenter you can do, and I'm sure your audience will realize that, is reading slides.
Oh, sure.
You don't want to have a slide with so many words on it. You want to have a simplified slide. You, as a speaker, should be able to highlight
Mm-hmm.
what is on
Mm-hmm.
that
Right.
slide and expand on it.
Right.
Now, I have also seen, and one of the worst presentations I have seen is people who read from note cards.
Oh, goodness.
So that tells
Yeah.
me that either you don't know the material.
Okay.
Now, having note card is not a problem. Having speaker notes is not a problem.
Mm-hmm.
The problem is just reading those. You
Mm-hmm.
feel confident enough about your slides. And my
Well, yeah, I was going to say
mistakes.
keep going on that because you were just starting to tell what that says to you, and I want you to keep going. Like you said, it tells me they don't know their information. Maybe low confidence was something else you're.
Exactly.
What else does that tell
But
you when you
it
see
also
someone?
tells you that you don't have the confidence of speaking in front of public.
Right, right.
You have the fear of it, and it's logical to have a
Well,
fear.
we all have the fear, right? That's normal. It's the matter of getting over that. We just did an episode a little ways back with Rusty Gaylord, who was talking about this very thing. Like, it's okay if you're nervous, but did you surmount that and get past it for my sake? Me being the audience member who wants to enjoy a fluid conversation. Mo, with the presentations you see, are you still seeing a lot of people reading slides? Is that pretty common when you walk, the earth, if you
It
will?
all depends on the subject,
Okay.
and it all depends on where they come from. Also, I would add to that, remember humor goes a long
Yes.
way
Oh,
in
I love that.
action.
Yes. Yes.
I'm not saying be a clown, but
No, there's a
same
artistic way to
time,
do that.
exactly.
Mm-hmm.
At the
Mm-hmm.
same time, a little joke here, a little
Mm-hmm. Mm-hmm. Yeah,
Essentially,
lighten it up. Lighten up
lighten
the
it up.
mood.
I think
Right.
the best presentations for me is that when the presenter feels like he's talking to his friends
Oh, great. Love that.
and
Yes.
they're so comfortable
Yes.
just explaining the material. But at the same time, you have to remember uh, science for somebody who's not in science is difficult. You
Yes.
don't need to use all the big words that is on a slide.
Right. Right.
Translate it. Now,
Right.
if I am on that field, I understand that I'm reading that word on the slide, and when you translate it, I'm like, that's great.
Mm-hmm. You
But
you understand you're with everybody, right? Mo, did you kind of figure that out early on that because translating scientific terminology and bringing it down to a level. I remember in our initial conversation, I think somebody asked you to kind of like dumb it down for the
exactly,
finance
I
people.
was
Can you
going
tell
to
that
say that.
story?
So, as one of my consulting gigs, I worked for a venture capital company as a
Okay.
consultant. And the CEO of this company was a younger gentleman, and he goes, listen, I understand finance. I don't understand science. What I need you to do for me is this: dumb it down to the point that I know why I want to invest money into this, and I can translate that into my clients.
Boom.
And that to me, I guess, has stuck with me
Yes.
because there are times that and there are times that you look at audience and you see you lost them.
Yes.
Now, to
Yes.
make that difficult during with a lot of discussions were done online. And that was probably the hardest thing as a speaker you can do
Yes.
because you can't gauge your audience.
It's hard. It's really hard to read the Zoom room. And you've said two really important things here that I want to click again on because the dumb it down tip, I mean, frankly, I would just go with that terminology because that's what somebody said right to you is and it's meant in a helpful way, right? Help
Absolutely.
us. Help us
Absolutely.
help you is kind of the message there. So those listening who are in these loftier realms of science or high tech or deep engineering speak, dumb it down, but without patronizing, right? We want
Yeah.
to make sure we make people feel like they can learn, will learn, and we're going to start here, but bring them upward pretty quickly because they're smart people and they want to learn. And the
Listen,
second thing,
everybody is smart
yeah,
in
yeah,
their own way. And
right,
what you have to realize is not everybody's expert in every topic.
right, right.
If you can utilize that KISS principle,
Mm-hmm.
the last S, uh,
Keep it
you
simple, scientist,
just
maybe
keep
we
it
could
simple.
say.
Uh, if you can do that, you actually are going to be a much more influential individual than somebody who comes in and
Yes.
thinks that they know everything, they've done everything. And you said the best thing. Don't patronize your audience because the next time what happens is word does get around. People talk about things. And um, I think the biggest sign of a successful speaker is being asked to present again.
Ooh, I
Been
love that.
fortunate enough to present at some meetings that, they reach out and they're like, can you present again? And I'm like,
Yes.
well, I don't have anything new to present. And they're like, that's okay. Your
Yes.
presentation was so good. We
Do it
want you to
again.
do it again.
Well, you said a key word earlier too, like people are looking to become more influential. And one of the signs that you're being influential is being asked to re-present your presentation to a new audience, maybe take it up a notch and meet
Exactly.
that audience. But influence is how we get things done and ideas move forward. And so that's a huge compliment to you, Mo, and anybody out there who's being invited back. That's a sign you're doing something right, right?
Thank
And
you.
so,
I
um,
would say I have never been kicked out of a place.
good. Let's keep
So
it that
I
way.
think I'm doing something right at the moment.
Yes, yes. Well, I want to offer one thought to our audience on something we said earlier around when you feel like you've lost your audience and just provide a quick tip and encouragement that if you look out in the audience and you feel like you have lost them, or they are, elsewhere, or even in the Zoom room, you do have an opportunity, if you're savvy enough and if you know your message well enough, that you can bring them back in. Now, that takes a little bit of practice, a little bit of the right words, but you can say something like, I'm noticing maybe it would help if I go back and bring this home again in a new way. So I'm going to actually pause and hit this slide one more time and see where questions are coming up for you. So if you think about the words I said, I haven't knocked anybody down, I haven't, insulted anybody, and I've taken it upon myself to go backwards because I'm noticing things. And I'll tell you what, you will earn so much respect for doing that because you have told the audience that you see them,
Yeah.
and they are
I
going to
would
come
say
back.
to that point, Cindy, again, it's important to engage your audience.
Yes,
One of the best way of rolling everybody back in
yes,
that
yes,
zero
yes,
is to ask,
yes,
does this make sense?
yes.
Does this, do you feel like you capture enough information out of this, whatever presentation, to go back and utilize it? Is there
Yep.
something missing I can explain
Yes.
first?
What
So
questions do you have? Right.
that we are humans, and
Yep.
communication is what before beside the opposable thumb is what makes us different than other species.
Yes. Yes. 100%.
If you can talk to people,
Mm-hmm.
people will talk back, and
Yeah.
that's something you have to realize. That's what makes us better.
So simple and very well said.
And,
Um,
and those are the things you learn as you do more speaking
yeah.
engagement. Those are the
Yeah.
things you learn. And a speaker is the master of the room per se.
Yeah.
You
Oh,
have to be able to steer that ship to make
yep.
sure it gets safe.
That's right. Oh, it's beautifully said and so true. It's your job to steer that ship to the best of your ability. And you really can become a better speaker just by watching other people. You can become a better speaker by not saying a word. You can be observant of people doing it well and try to adopt their behaviors the next time you go out to do your own speaking event. And it sounds like you've done a lot of that in
And I
your
would
life,
say one
Mo.
other thing is learn to say, I don't know. If you
Yes.
don't know something, it
Mm-hmm.
so much more credibility.
Mm.
Early on, I
Yep.
wasn't this way because I'm
Yeah.
trying to say, I'm here because you asked me to be the expert.
Mm-hmm. Mm-hmm.
But and then as you learn,
Mm-hmm.
as you hear other very valued individuals say,
Yeah.
good question, I didn't
Right.
think of it this way, or I don't know that.
Yes.
And you see that even the best and the brightest don't know everything. And
Yes, they
yeah,
don't.
it is very important from a
Yes,
ability perspective to say I don't know.
it is. It absolutely
We
is.
have way
That's
too many people right now in the world that they think they know everything.
right.
And
Yes.
that is going to impact us in a worse way than saying I don't know.
Mm-hmm. Well, it's a good segue. I was about to ask you as we kind of land the plane here, Mo, what's happening in the next 12 months or so in your industry or in adjacent industries that you're seeing, and maybe it's in terms of communications, maybe it's in terms of product development, maybe it's in terms of patient care, healthcare. What would be kind of rattling around in your mind right now as you're looking ahead?
I don't want to get political, but I like the segue and the industry again. It's going through some changes.
Yeah, well, we have a new administration. There's no question, that's a reality, and there's a lot happening there. So that's
Yes, and if experience is anything that teaches knowing that science doesn't prevail with certain individuals, I have to wait and see.
sure.
Am I worried as somebody who has been in healthcare for so many years,
Mm-hmm.
seeing what happened during the pandemic initially, uh,
Mm-hmm.
both as an infectious disease diagnostic individual, but now in other areas, it's just the waiting game to
Mm-hmm.
see would would individuals in power actually listen to the
Mm-hmm.
voice science, or is it again going to be a story of I don't believe in it, so I'm not going to do it?
Okay. Okay.
You know,
Well, yeah, it is a real concern, and it's going to drive impact and action, and it's going to change the way things unfold, and we are waiting to see. And so, what advice might you have? I'm thinking of concepts around listening and mindset management. What's kind of a thought you can share with your colleagues in
I
the
would say
community?
colleagues in every industry, you don't change yourself.
Mm.
Do what you have done as clinicians, as executive in healthcare.
Mm-hmm.
Um, the good thing about how administrations work is that their lifetime is short, thankfully.
Right.
So you don't suddenly see all us doctors just evade and go for vacation for 4 years. No, we have a responsibility. We took oath
Yeah.
to take care of people,
Mm-hmm.
and that's
Mm-hmm.
what my colleagues who are practicing right now. That's my colleague who did practice during COVID did.
Mm-hmm. Yes, we
Um,
owe a lot to all of the doctors who
so
helped.
I would say just do what you were doing. Don't let the don't let politics immediately impact your
Yeah.
mind. I
Mm-hmm.
know we are worried. I as a part of the IDSA, Infectious Disease Society of America, I get emails every day.
Mm-hmm.
That was a big group of individuals that were impacted during COVID,
Yeah.
uh,
Yeah.
rightfully so.
Sure. Sure.
And we saw that eventually science prevailed.
Yeah.
It
Well,
was
so
difficult, but
mm-hmm.
but you end up prevailing, and the public has a lot to do with it as well.
Sure. Sure. We are an engaged audience, if you
Yeah,
will.
and we also know that medications or vaccines or whatever precautions we have had historically has shown that they work.
Mm-hmm.
We have cases of certain diseases increasing because people have decided not to get the vaccine. And at
Mm-hmm.
the end of the
Mm-hmm.
day, they have to realize that what they do, it impacts globally, not just
Right.
not regional. One thing I would say COVID taught us from the perspective of disease and spread of disease is that it's no longer one place.
Mm-hmm.
It's just like the stock market. It
Mm-hmm.
global impact. And
Mm-hmm.
when you have that global impact, um, if we don't get on the train, we
Mm-hmm.
get left behind because the rest of the world is no longer is going to wait for us to be the leaders.
Right.
Well, the
Well,
tables turn.
yeah, and Mo, what I appreciate, and thank you for kind of going in this direction. I'm seeing, we're really talking about meta communication at some level here, right? Where we're communicating about communication, and the conversation about health communication and how we communicate about it is at this higher level, right? This much bigger umbrella, and it's hard to navigate that. There's so many cross-functional, so to speak, players in the room and it takes longer with this much activity in the room, if you in the proverbial room that we're all in together globally. So it is not a quick fix. It is, to your point, important that we stay true to what we do know, what we are expert at, and stay the course and control our controllables, right, in that
And I would
area.
say I would also add to that when you're looking at disease in general, in the past, as providers, as scientists, we would look at disease epidemiology from the perspective of what population is going to impact and
Mm-hmm.
how we going to prevent it.
Mm-hmm.
With the way the global world works now, and COVID showed us that it wasn't just the disease itself, it impacted life
Yes.
from the perspective of manufacturing. Who would have thought?
Right.
I'm a car guy, as you can tell.
Yes.
Who would have thought that COVID would impact new car sales? Because a chip that's coming from one place in the world wasn't being produced
Right.
anymore.
Right. It was very far reaching without question.
Who would have? So the more and you can consider pandemics like natural disaster. They are natural
Yes.
disasters.
Right.
Nowadays, as we can see, the impact of natural phenomena are way more than just locals.
Yes.
It's
Yes.
impacting everything globally in transportation, in transfer of material, in transfer of goods. Um, so when you're looking at from the perspective of a disease state, there is so much more involved in that disease state than used to be because of
Mm-hmm.
the world
Mm-hmm.
war. Who would
Mm-hmm.
have people across the world would sit on a Zoom and talk to each other?
Well, at the rate and volume that we are, right? Yes, it's changed everything. And we're 5 years out and still noticing the permanent changes that
Yeah.
we've all experienced together. And yeah, the change is permanent in a lot of areas and ways. And we've adapted, right, in many ways, especially in terms of look at us now, right? I never would have probably had the opportunity to have this conversation if Zoom and virtual environments on other platforms wasn't
Absolutely.
such a prevalent way that we do things now. So that's
Absolutely.
been,
Actually, a lot of places prefer this because
yeah,
so
saves
much cheaper
travel.
per se.
Yes,
You
sure,
don't have to
sure.
fly somebody.
Yeah,
Who would have thought we would do interview processes?
yeah,
And
right.
the last step of interview is actually when you meet someone in
Yes, that's fascinating. I love that. Mo, one more question for you, and I would love to have you just pick which one you'd like to answer. One option is, somebody that you admire who has really formed and shaped you that you'd like to highlight today, or you could drop us like a great book that you're reading that's helping you get to the next level of you, Dr. Abouzari.
Well, I would say somebody that formed me was my uncle, who
Your
was
uncle.
actually a clinician himself.
Okay.
And he probably was the reason early on in my age I wanted to be a clinician.
Okay.
He, from family perspective, from the perspective of what he did for the society, he
Mm,
respected me, and
mm,
that has stuck with me. He passed away several years ago.
mm,
I still have his picture
mm.
on my table.
Yeah. Oh, that's beautiful. What type of doctor was he,
He
or
was a
what?
pediatrician,
A pediatrician. Oh, well,
and
that's beautiful.
for the longest time, I wanted to become a pediatrician until I learned it's not all fun and games.
Right. Well, I can, I have 4 children. I've seen a lot of pediatricians in my life, and we have a lot of gratitude for pediatricians specifically, but all doctors and those who take care of us.
Absolutely.
So thank
It's
you.
funny. I want to give a shout out to everybody in healthcare because
Yeah.
healthcare would not run around.
Mm.
The person who's cleaning the hospital to the person
Hmm.
who
Yeah.
running the hospital. The
Yep.
three level laboratories, we tend to look away and think the
Hmm.
doctor is the greatest doctor. Yeah, but the supporting staff,
Yep.
they don't have the tests
Yep.
coming from the laboratory. If they don't have the pharmacist who supports the
Hmm.
medication, if they don't have the imaging folks that give
Hmm.
medicine is great. Yes, as a clinician, you need to understand disease state, you need to understand how to treat it. But all these supporting staff,
Yeah.
the
Yeah.
nurses who actually
Oh,
take care of the patients in the
absolutely.
hospital,
Yes.
you got
Yes.
to give to all of them a credit
Yes. Oh, it's a
because
team
without
sport.
them, yeah, it's
Yeah.
without them, a doctor is basically an individual who thinks he knows a lot.
Yeah. Oh, that's a really great way to end our time together. And I'm thinking of all the people I know, my cousin who's an imaging expert and the nurse who drew my blood a few weeks ago to get some answers for me and all the people who've helped me and my family over the years. And we owe a great debt of gratitude to all of our healthcare providers, from the person cleaning the bedpans or the walls of the bathrooms and the sinks to the surgeons, and so everybody in between. So
And there
thank
is a
you.
book I want to recommend. I don't know if I can remember the title. I had it. Um, thing is, it was called Making a Story Stick. I think that's what
Oh, I
the
bet.
name of it.
Yep.
I
It's
I
called
have
Made.
it
It's called
somewhere.
Made to Stick.
Made to Stick. There you
Made to Stick. It's on my bookshelf.
I
Yes.
know is it more focuses on sales and commercial.
Yeah. Oh, it's a great book.
I think it resonates way more in everything.
Yes.
You brought up this great point of telling the story,
Yeah.
and I think when you tell a story as a speaker, it makes you connect to the audience from the perspective of them realizing that you are also a human being.
Yes. Well said. That's perfectly put. Yes. Well, I'm excited, Mo. Once you are into second quarter this year or so, you'll be able to pick up our book, the one that I've written, which is heavy on story, called Red Light, Green Light. And so that's the impetus for this podcast, is to help people understand our light's structure of persuasion and story, and to get into the nitty gritty of communications and communicating with excellence. So thank you for being with us today, Dr. Abouzari. I'm very grateful for your storytelling and your expertise, and we really look forward to more conversations with you in the future.
Sounds great. Thank you very
Thank
much for
you.
the invitation.
Yes. Thanks everybody for watching and listening, and we'll be back with you again in another week with another amazing guest. Until then, have a great rest of your day. Get out there and nail it. Bye-bye.